Hi, my name is Rennie Arake, and I have hyperhidrosis. I've been dealing with it since elementary school, going on 20 plus years now. And I got to the point where enough is enough. I'm trying to find solutions and answers. So I flew from Los Angeles, California to Norfolk, Virginia to meet with one of the leading doctors in hyperhidrosis, who also happens to be the founding president of the International Hyperhidrosis Society, Dr. David Pariser. I wanted to share my frustration, my experience, and I hope that my consultation with Dr. Pariser will help others like myself get some insight on this condition.
Rennie, how long have you had trouble with sweating problems?
I've probably since all I can remember. I always sweat more than the average person, but then I think once around junior high, the hands, the feet, and the auxiliaries just started getting worse.
So hands and feet came first before
Yes.
the others did?
Yes.
Okay. Yeah, it's often the case. In fact, sometimes hands and feet will start in childhood, and underarms usually start around puberty, middle school. A lot of times people don't really know that there is family history in these things. I've had patients where had a teenage girl one time sitting on the table right here, and mom was sitting in the chair. And I asked the question, and the girl said, no, nobody in that family has it. And the mom said, well, honey, I hate to tell you, but I've had it all my life. I've never talked to you about it. And the girl started after the mother, why did you say that? Why didn't you tell me that you ever had it? And the mom says, and grandma's had it too. So there is a lot of family history people don't even talk about because, as you know, sweating is a common problem that people don't like to talk about, get embarrassed about. What bothers you the most? Which parts of your body?
I would say probably the hands.
Okay, tell me a story. What's the worst story that's happened to you with your hands sweating? The most embarrassing
The
thing?
most embarrassing thing is trying to dance with somebody and your hands are just playing football, and if I don't have gloves, there's no way I can play football. Like, remember when I was younger, high school, it's just so hard to grip that ball. So I played defense.
Okay, well,
I was like, you know what? No, I'm not going to bother with that.
yeah, I mean,
Gripping is a big issue.
There's all kinds of stories. I always ask for a story. A policeman who couldn't fire his gun because he would get his hands wet. Had a mother who dropped her baby. His hands were so wet. Had a baseball pitcher who threw a 100-mile-an-hour fastball and couldn't hold it because his hands were too sweaty. So it really does affect quality of life as much as anything else that people do. Are you generally good health?
Yes.
No. Do you take any medications for any reason? Okay, because as you know, sweating sometimes can be due to general health problems, infections, and diseases like diabetes, and infections like tuberculosis, other things, but not in your case. Nothing. No medicines, no diseases, no nothing. Healthy, perfectly healthy otherwise. Okay. All right. So what happens when you have hyperhidrosis? When you have excessive sweating, what happens is the sweat glands sweat at times when they're not supposed to. Normally, people sweat when they're hot, when they're nervous, and when they're exercising. But if you've got this condition called hyperhidrosis, you sweat all the time. And there's nothing the matter with your sweat glands themselves. If you took a biopsy of the skin and looked under the microscope, those sweat glands would look just like anybody else's. The difference is that they're stuck in the on position because the nerve that stimulates them is producing a little chemical called acetylcholine, which turns on the nerve. So the problem is not the sweat glands, it's what we call the sympathetic nervous system, the nervous system that we have no control over. That controls our heart rate, our blood pressure, and it's controlling your sweat glands by being stuck. The switch is stuck, and that's why excessive sweat. The body areas that you have it are the most typical spots: underarms, hands and feet. Other common areas: face, people have face and scalp, sometimes in the groin, other areas as well. What kind of treatments have you had for this? What have you done for it?
I haven't had any.
I've had no treatment.
I got to the point where I need to find a solution.
So you haven't really tried anything? Now you haven't gone to the drugstore and bought any kind of stuff? Nothing?
I just
didn't buy anything over the internet?
But just try to buy the stronger deodorant, the medicated types, over the counter.
Okay.
And I just try to eat as clean as possible. I feel like when I eat better, it's less, but during the summer, there's just no control.
Okay, so are there any triggers that you figured that make this better or worse?
Caffeinated, if I drink alcohol, if I eat a really heavy starchy meal, those definitely there's no control in
Okay. And when that happens, does the sweat happen in all the body areas that you talked about? Hands,
Yes.
feet, underarm?
Yeah.
Do you sweat at night?
No, when I sleep, everything's asleep.
Okay, that's very characteristic. of hyperhidrosis, of the kind that's not caused by medicines and disease and is that sweating stops at night. Is it every day, by the way? Do you have it every day?
Yes.
Every day? All day, every day?
There'd be like a
got a sweat ring under your arm right now?
Yeah, I got one right now.
All right, okay. All right. Okay, well, all right. So the treatments for this depend on which body areas we're talking about, because we can control sweating pretty much in any one individual area or in all the areas, depending on the extent and the what you're willing to put up with in terms of treatments. So let's talk first about the underarms, which is what we most commonly treat. Underarm sweating, if you have tried the over-the-counter clinical strength kind of antiperspirants that you can buy in the drugstore, and you get no response from that, then you're ready for one of the two major treatments for this. One is injections of Botox. We'll talk about that in a minute. And the other is treatment with a device called a Miradry, which is a microwave device. And I'll explain a little bit about each of those to you. This is talking about underarms now. So you say Botox. Botox, isn't that the stuff that old ladies get injected in their face for wrinkles? How in the world can that do anything for sweat? Well, guess what causes wrinkles? Wrinkles are caused in the face by repeated muscle contraction due to secretion of acetylcholine, that same chemical that causes the nerves to sweat, that makes the nerve cause the sweat gland to sweat. That's what causes muscles to contract and causes wrinkles. So by blocking acetylcholine in people's muscles of their face, it blocks wrinkles. Same reason, that's how it works in both conditions. Botox injections are minimally invasive and minimally to little painful. It involves multiple tiny needle pricks, putting Botox under the arms. It's done in the office. No anesthesia is needed. It's virtually painless. I've done it hundreds of times. No one has ever jumped up and run away and said, I'm never going to come back. And if we injected Botox under your arms today, your sweating would be 100% stopped within a handful of days to a week. And it would stay stopped for a number of months. Now, how many months? Well, usually in 2 to 3 months, you might notice a little bit. In 4 to 5 months, you might notice a little more. 5 to 6 months, it might be halfway back to where it was now, and you would say, well, I'm going to come back and do that again. I don't want to ever have that. So it doesn't last forever. In the original clinical studies, 43% of the people were able to go a whole year without having to have another injection. It works great, but it's not permanent. The Miradry, which is a microwave thermolysis device, it's called, works in a different way under the arms. It kills the sweat glands with microwaves. It actually physically fries them. And it provides a permanent solution to the sweating issue under the arms, only under the arms. It is moderately bit painful. When I say that, not at the time of the treatment, it's all numbed with anesthesia, local anesthesia injected under the arm. But for that night and the next day, there's some pain and discomfort there, and there's some swelling, and you need to put some ice under there and take it easy. And we usually like to do it, say on a Thursday, take Friday off, take it easy for the weekend, and you're fine by Monday most of the time. There is some temporary swelling, there's some temporary numbness, no permanent damage and no permanent side effects, but the results that you get with the Miradry are permanent. Most people need 2 treatments spaced about 3 months apart. Sometimes we can get away with one patient in 20 needs a third one. But the results of the Miradry treatment are permanent. Now, the differences, also difference in the two, Botox treatments can often be covered by insurance, and the Miradry treatments are never covered. It's just the way this device is structured. Treatments are expensive. Botox treatments without insurance, if you didn't have insurance, depending on where you are in the country, it varies a whole lot, and on the West Coast it's more where you are, but it's going to be anywhere from $850 to $1,500 to do 2 underarms at one time, and doing that sometimes twice a year. The Miradry treatment costs around $3,000 for the 2 treatments. Sometimes you can get away with one, and usually when one treatment is done, it's usually $2,000 for the first and $1,000 for the second. That doesn't vary too much around the country, but you'll find that there may be some variation. So that's the story on the underarms. Okay, underarm sweating can be pretty much taken care of with one of those two treatments. All right, now let's talk about the hands and feet. The hands, you can actually use antiperspirants on the hands, and some people do, and some people get some effect from it.
Yeah, I've used the aluminum chloride on their arm.
You try that? Let me see, are your hands wet? Yeah, they're pretty wet. Is this what they're like all the time?
For the most part, yeah.
Can you ever get to the point where you can hold your hands up and see water drip off of them?
Especially.
That's kind of cool.
Yeah, it's not that I get nervous, but when I'm busy, like it's just like.
It just happens, yeah, all right.
It just happens.
All right, so for the hands, there's a procedure called iontophoresis, which is in the book there that you got. Iontophoresis is a type of physical therapy where you put your hands in trays of water, plain water out of the sink, and an electric current is passed through the water, a special kind of current. 15 to 18 milliamps of direct current, to be exact. And what that does, in effect, it short circuits the nerves to the glands. That's a little bit of a simplification. Doesn't exactly do that, but that's a good explanation of how it does it. And if you do this treatment 3 times a week, 20 minutes a time, usually, and stick with it, usually within several weeks, you can get a pretty decent reduction of sweat in the hands and the feet. You can do that on the feet too. Hands and feet, iontophoresis. But I'll tell you that usually about half the people who I start on that don't really carry through with it. It gets to be a real pain to have to do this for 20 minutes. Balancing trays of water and put them on the floor for your feet and on the desk for your hands. And it's a complex treatment. It's something you can do at home, by the way. Normally we do that in the office for the first 2 weeks or so to be sure that it works. And then if it does, we try to see if we can get your insurance company to buy the machine, and you do the treatments at home. That's for hands and feet only. It works pretty well, and I would suggest for most people that be the way we start for hands and feet. Now, if that doesn't work, or it looks like you can't tolerate that, or just inconvenient, and if you're people who travel, or college students in a dorm room, or something where you can't really just can't do it, we go on to the next stage. And the next stage for the hands is Botox injections to the hands. And if you find that the iontophoresis doesn't work, Botox in the hands works great. Now that's not a painless procedure. You can imagine 15 or 20 needle pricks in the palm and 5 or 6 in each finger. That requires some anesthesia. And there actually is a very simple and easy way to get anesthesia that we use with ice and pressure. That's completely works very well, and there's no side effects to it. There's no drugs or anything administered. At the sweathelp.org website, if you go on that and go to the part about for healthcare professionals, there's a video library that shows the exact technique of how to of injection of the palms and soles. You can do the feet too, the same thing. Palms more commonly done, to see how the Botox injections work. Now, just like the underarms, the results are not permanent, and it has to be repeated. But this is another thing which we do all the time for the hands and for the feet. Okay, now there are a couple of other things that can be done other than these kinds of treatments, and for people who have it in multiple areas. Because if we were to do yours in the way I would suggest, we would be doing either Botox or MiraDry under the arms, and iontophoresis or Botox in the hands. Now, the fact that you're not exactly living around the corner here, it's going to be a little difficult. That's a consideration. Two is, how far away do you have to go to get treatment? So there are medications that can be administered, taken internally to help sweating. There's no medicine that's approved by the FDA for that, and there's no medicine that's been extensively studied for it. But we know that there are medicines that are used for other things which have as a side effect reduction of sweat. So we will sometimes use a medicine that was designed for something else to get its side effect. So the problem is with these medicines is that when you take them, there are other things that are going to happen to you. And that makes it a little difficult for some folks. Most common medicine we use is something called an anticholinergic. There's a medicine called glycopyrrolate. That's the pill, actual name of the pill. It's been around for about 35 years and was originally developed to treat stomach ulcers. It's not used for that anymore, but one of the side effects that it has is it reduces sweat. Dries up also other body fluids. So people who take that will get a dry mouth, dry eyes. No, you don't get dehydrated, but you have trouble peeing sometimes. Sometimes dry eyes and blurred vision, and so forth. But in some people, we'll find a dose that's high enough to get some reduction of sweating without too much of the dry mouth, dry eyes, and that sort of thing. That requires a dose where we start off very low and we increase the dose slowly to get your body used to it. But we're providing a systemic treatment for something which is localized. But it does help some degree for some people who have multiple areas of this. There are surgical treatments for this. And I'm sure if you've been online and looked it up, you've seen about the various surgery, the ETS surgery. So ETS is a procedure that works very well for hands, works 50-50 for underarms, doesn't do anything for the feet. And the way ETS works is it's they go into your chest, they deflate your lung, they find the nerves that go to the hand and the arm, and they cut them or clip them, and then they blow up that lung, turn you over to the other side, and do the other side. It's a major surgical procedure, but the complications of surgery themselves are not that much anymore. They've gotten pretty good at doing the surgery. But the major problem with ETS is that up to 80% of people who have that surgery will get what's called compensatory hyperhidrosis, which means that they sweat even more in other body areas. And despite a lot of people trying to figure out how to predict ahead of time who's going to get that and who's not, you can't. And it's one of those side effects that people get. You say, well, so what? I don't care if I sweat more. If I quit sweating under my arms and my hands, I don't care if I sweat more. Well, I can show you pictures of people who have had the surgery, who sweat so much that they'll wet their T-shirt in 5 minutes. I had a lady who had it one time who, if she didn't wear a diaper, she would leave a puddle of sweat in the chair when she would sit there. The Hyperhidrosis Society every week gets calls from people who are literally suicidal because of the side effect. So that I do not recommend that, except as an absolute last resort when people have tried everything else and it's all failed. So that's kind of the short story on this, and I want to be sure I answer any questions that you have about it. There are a lot of details we could talk about if you're interested.
Yeah, for topical treatments, I've read a lot on the forums about antihydro. I know it's not sold in the United States. It's actually a German product. I don't know if you've heard of it or...
I think that is a complex aluminum salt, isn't it? I'm not sure actually what that specific thing is. All the antiperspirants work in a certain way, and the chemistry of antiperspirants is what they do is they usually have aluminum or zirconium salt, a chemical, which in the face of water from the sweat precipitates and makes a physical deposit that plugs the sweat gland. And that physical plug in the sweat gland causes a feedback mechanism whereby it stops making sweat. So that's how they all work. The problem is, in the process of making that chemical reaction, there's an irritating acid formation. And that's the limitation of why you can only have certain strengths of those topical agents because of the acid formation that occurs. Now there's another particular product that combines one of these aluminum salts with a different kind of acid preparation that softens the pores a little bit and it's supposed to help a little bit more. But frankly, when somebody has as wet hands as you have and the underarm stains that I saw, I don't think you're going to get any effect from anything topical. You're sweating so much that there's no real chance for those topicals to get into the pores before the sweat's going to wash them out.
Right. And have you found in the past where like the sooner a patient comes in, like age-wise, the better results they get with their treatments?
It's so variable from one person to another that it's really hard to say that. I mean, the treatments that I talked about, Botox, Miraidry, oral pills, work just about as well in anybody, any age. Most people who come in for treatment are young adults. That we have treated children. We've treated, children as young as kindergarten time, which is when palm sweating often starts. And old people too, but I don't think it really matters. I think whatever age you are, you have the same degree of improvement or chance of improvement from treatment.
Okay, yeah. Well, I appreciate what you're doing and spreading the awareness. And there's a lot of people out there who are very shy about it, don't want to speak about it. But after listening to your podcast, reading your book, I was like, I have to meet a doctor.
All right. Well, I'm sure you can find somebody out there. In fact, the International Hyperhidrosis Society. The website is sweathelp.org, where nobody's selling anything. It's just an informational. People can sign up on that website. They can become part of a community of almost 50,000 people worldwide who are parts of this. And there is a physician finder in there that lists docs by zip code in the US and in other countries who are interested in hyperhidrosis. There are some of them who have been educated by the Hyperhidrosis Society, by me and others who know how to do this, and that's indicated, and I know there are people in Southern California and elsewhere, just about not everywhere in the country, but in other places who would be able to help with any of these forms of treatment. Let's talk about the MiraDry specifically. All right, the MiraDry treatment, it's a microwave device. The way it works is that it has a little handpiece, looks kind of like a hairdryer. You put it on the skin, it kind of sucks up a little bit of the skin into it and shoots and cools the surface while it's shooting microwaves in to actually fry the sweat glands. And I tell people this is the analogy: if you took a piece of chicken fat and put it in a microwave oven, what would it do? It would crispy and crinkle and fry. Well, that's exactly what we're doing under your arms, in a manner of speaking, a little more controlled fashion. But it physically destroys the sweat glands. It also destroys the other glands called the apocrine glands, which is what makes body odor, and it also destroys hair follicles, which sometimes means that you lose underarm hair, which women like and some men don't like, but it may do that as well. The treatment is administered under local anesthesia. The whole area is numb, so you should feel very little during the treatment. It takes about 2 hours to do it. So it's a tedious procedure because it's done a little bit at a time over the entire surface of both underarms. Afterwards, after you have that done, like I said before, there's swelling, there's some pain and discomfort. We have you take ibuprofen for the first 24 to 48 hours, pretty heavy prescription-sized doses of ibuprofen. I usually get prescription for even stronger pain medicine, and some people don't even fill the prescription for that. You need to keep it iced and take the ibuprofen for 24, 48 hours, and usually by 2-3 days later you're fine, but there is some discomfort. There have been some cases of a little bit of numbness in the area. There have been some cases of lumpiness that has persisted for a few months, but that usually goes away. There are no long-term adverse side effects from it. The results are permanent in most people, but they're not 100%. It's hard to get every single sweat gland with those microwaves. The Botox is pretty much 100%, but it doesn't last. The MiraDry, realistically, 85-90% improvement, which is enough for most people. To have that degree. Many people do get 100%, but it's not the kind of thing where it should be expected always 100%. Okay. But it's virtually everyone who does it is happy with it. But you do have to have 2 treatments much of the time. Now, some of the newer ways we're doing it, we can get away with 1, but I tell people expect 2, and if it works well with 1, you'll be happy, but expect 2. Right.
Do you feel like in the future, maybe the insurance will start covering this type of treatment?
I don't know about whether it will or not. Quite frankly, it's not really it is up to the insurance whether they'll cover it, but the manufacturer of the device seems to have no incentive to try to work toward insurance coverage. So that's something that I don't personally agree with. I'd like to see this covered because we're treating a real disease. And when you think about it, if I'm an insurance company, I'd rather pay to have this done once than pay for Botox twice a year for a long time. It's going to cost me a whole lot less to pay for the MiraDry in the long run. And actually people whose insurance doesn't cover it feel the same way. Usually, I'd rather pay for it and get it over with than have to be doing Botox once every 6-9 months or something.
Okay. Thank you so much.
All right.